Have you ever wondered what truly happens inside a woman's body when her periods stop? Not for a month, not for a year, but forever? This natural biological event is called menopause, a powerful transition, not a disease that marks the end of a woman's reproductive years. It usually occurs between the ages of 45 to 55. When the ovaries gradually stop producing estrogen and progesterone, the key female hormones. But this change isn't just physical, it's emotional, mental, and social too. Every nurse, every doctor, and every healthcare student must understand that menopause is more than just the end of menstruation. It's a complete hormonal shift that impacts almost every system in the body, from bones to the brain. Let's unfold this transformation step by step. When estrogen levels fall, the entire body begins to respond. The most common and early symptom: hot flashes, sudden waves of heat that leave a woman flushed, sweaty, and sometimes anxious. Why? Because estrogen helps regulate body temperature through the hypothalamus. When it drops, that balance breaks. Next comes night sweats and insomnia, because the body can maintain its thermal control during rest. Mood swings, irritability, and depression follow, as low estrogen affects serotonin levels in the brain. Vaginal dryness and painful intercourse occur because estrogen keeps vaginal tissues elastic and moist. You'll also notice irregular periods, loss of libido, weight gain, and hair thinning. Over time, the reduction in estrogen weakens bone density, leading to osteoporosis. These symptoms are the body's way of adapting to hormonal withdrawal, each one telling a physiological story. Let's look inside the body to understand what's really happening. It begins with ovarian aging, follicles decrease in number and sensitivity. The hypothalamus senses reduced estrogen, so it signals the pituitary gland to release more FSH and LH in an attempt to stimulate the ovaries. But the ovaries no longer respond effectively, leading to low estrogen and high gonadotropin levels, the hallmark of menopause. This hormonal imbalance disrupts the thermoregulatory center, causing vasomotor instability, the reason behind hot flashes and night sweats. The decline in estrogen also reduces collagen synthesis and calcium absorption, weakening bones and skin elasticity. The urogenital tract becomes thinner and less lubricated, while lipid metabolism changes, increasing LDL cholesterol and cardiovascular risk. Menopause, therefore, is not just the end of menstruation. It's a cascade of physiological adjustments affecting nearly every organ system. Now, when it comes to treatment, management focuses on relieving symptoms and preventing long-term complications. The cornerstone is hormone replacement therapy, HRT, where estrogen, sometimes combined with progesterone, is prescribed to balance hormonal levels. However, it's used cautiously because long-term use can increase the risk of breast cancer and cardiovascular disease. For women who can't take HRT, non-hormonal therapies such as SSR is like fluoxetine and paroxetine help manage hot flashes and mood changes. Calcium and vitamin D supplements are essential to prevent osteoporosis. Bisphosphonates may also be given to strengthen bones. Lifestyle modifications play a crucial role: regular exercise, a balanced diet, stress management, and adequate sleep can all ease menopausal symptoms. Patient education and counseling are vital, especially for nurses and healthcare providers. To guide women safely through this phase of life, nursing care for a woman experiencing menopause requires holistic support: physical, emotional, and educational. First, assess her symptoms, lifestyle, and emotional well-being. Encourage open communication. Many women silently struggle with mood changes or sexual discomfort due to cultural stigma. Teach them about dietary needs rich in calcium and phytoestrogens, like soy, which can mimic estrogen naturally. Promote weight-bearing exercises to maintain bone density. Educate about avoiding caffeine, alcohol, and smoking, as they worsen hot flashes and bone loss. Offer relaxation techniques such as deep breathing, yoga, or meditation for stress relief. If the patient is on HRT, monitor for side effects like breast tenderness or leg pain and ensure regular breast and pelvic examinations. Above all, provide empathy and reassurance. Remind her that menopause is not an ending, but a new beginning, a stage of wisdom, strength, and renewal.